right? Don't you love nursing school? You do today, right? So we're doing clotting, and blood administration and anticoagulants are two areas in the area of clotting that have some safety issues. And we know these areas are on the NCLEX, or on your NCLEX blueprint, and that's important. If it's on, I feel like if it's on the NCLEX blueprint and they care enough to make sure it's on there, we should be pretty sure we teach it, so you guys are ready to go to the exam in just a few short months, right? So this activity is based on blood administration. And the PowerPoint you used this morning with Professor Sartoris is posted in Canvas for you, or the PowerPoint that I've also posted in Canvas, slightly different but has a lot of the same information. Or you can use either one of them. I'm going to start you out as we work through this, and you can work with partners as we go through the rest of this activity. It's a clinical judgment activity, which means it's going to ask you to make some decisions. It's not a perfect world in a case study, right? Nor is it a perfect world in the hospital. The hospital is never exactly like your textbook. And I realize the mix of patients I've given you in this, you probably wouldn't have on the same unit, because there are some that are more susceptible to infection and some that might be having things. But for the purposes of the case study, it presents the clotting exemplars that I need to present. So let's start out, and you're a charge nurse on this really busy unit. You got plenty of help, that's fine. You got other nurses, UAPs, taking care of things. But because you're this expert RN, you've got to make some decisions, right? So in keeping with our office theme, our 4 patients we're focusing on today are all employees in the office. And so your first patient, you've got 4 patients on the unit that have either got orders for blood or they've recently had blood administered, okay? So your first patient is Stanley, and he's a 64-year-old male with a 25-pack year history of smoking. So what does that mean, a 25-pack year history? Remember that from Cell Reg last year? It sounds like that's what it means, but it's not really. 25 packs a day would be horrible. A pack year is the number of packs per day times the number of years you smoked. So either smoked 12 and a half packs a day for 50 years, or he smoked 1 pack a day for 25 years, or 2 packs a day for 12 years, but he smoked 25 pack years. It equilibrates the amount of nicotine they've taken in depending on how much they smoke during the day. So he's got a history of chronic migraine and osteoarthritis, and he's in our unit with a GI bleed from excessive NSAID usage, right? You got migraines, you got arthritis, he's taking a lot of NSAIDs. He's got an NG tube to lower him in suction. He's NPO. He can ambulate with assistance. Got an IV of 1,000 of normal saline in his left forearm and 1,000 of D5W to 20 of K and M multivitamins in the other one, and infusing at 100 mils an hour in the other hand. He's got a hemoglobin of 7.2. His 4 o'clock vital signs were temp 99, pulse 105, respirations 20, blood pressure 112/78. He's an A negative, and he's got a unit of packed cells that was started at 1744. It's almost 1800, okay? You're at 1800, so this was just started, okay? Your next patient is a 28-year-old patient. He's got adenomatous polyposis, and that gave him colon cancer. Remember, that's a high heredity risk for colon cancer. And he's been admitted following his 3rd round of chemotherapy. He's got a hemoglobin of 6.8, white count of 1,800, and platelets of 157,000. His vital signs at 4 o'clock were 98.7 for temp, blood pressure 124/82, respirations 22. He's got a unit of whole blood that was started at noon. He had normal saline that it was completed at 4 o'clock. So within 4 hours it went in, and he's had his unit of blood. The next patient is a 70-year-old female, and she has a history of chronic renal insufficiency and mitral valve prolapse. She's also got hypertension. She weighs 195 pounds. She fell at home and fractured her hip. So she came in and she's had a cemented hip arthroplasty, right? So we fixed her hip, and so that was this morning. She came back from recovery 3 hours ago. Her orders are for activity with physical therapy. In the morning, she could do toe touch weight bearing only. She's got NPO except for ice chips until her bowel sounds come back. She's got a wound drain in place to her right hip with 50 mils of sanguineous drainage. Know what sanguineous means? Red, looks like blood. We can't prove it's blood without examining it more, but it looks blood. And her hemoglobin in recovery room was 8.1. Her PT and her INR are 18 and 1.8. You talked about that today, right? Yeah. Her vital signs at 1600 were that her temp was 97.9, 146 over 87. For her blood pressure, pulse 94, respirations 24. She has a unit of packed cells that started at 420. And so it should be well along the way in getting, she's about halfway through, maybe a little more, right? Because it's almost, if it started at 4:20, it's almost 6 o'clock, so she's about 2 hours in. And then your last case is a 47-year-old male admitted 3 days after a motorcycle accident. It's 3 days ago, he had a motorcycle accident. He had a laceration of the liver, a ruptured spleen, a fractured left humerus, and a fractured pelvis. He has multiple abrasions, lacerations, and ecchymotic areas. He has had abdominal surgery to repair the liver and perform a splenectomy. His left humerus had an open reduction, internal fixation, and he's in an immobilization device. His vital signs at 4 o'clock, he had 100.2 temp, blood pressure 104/76, pulse 88, respirations 18. He has had multiple transfusions over the last 24 hours. His last 2 transfusions were administered since lunch. The last blood bag completed at 5:30. Okay? So there's your patients. Okay? That's 4 patients that have had or are getting blood, right? So you've taken report, you're this outstanding nurse, and the UAP comes up to you right at 6 and says, hey, I've made rounds on patients. I've got 4 patients I'm a little concerned about. Mr. Hudson says he has low back pain and his skin is itching and he's asking for something for the pain. Jo Bennett is not oriented, and she was earlier. She's having trouble breathing and she wants another pillow. Ryan Howard threw up twice and now he's got the chills and says he feels really weak. And Oscar Martinez has weakness and chills and muscle spasms. Okay? So non-specific symptoms, right? Nothing in there that's going, oh, this is exactly what's wrong with me, right? But you are a great nurse, and you've had 4 patients with blood, and now they have complaints. So what I'm asking you to do with the first little piece here is to type in there, write in there, whatever you want to do, make notes on your paper. You don't have to turn this in, so it's however it works for you. What 4 cues for each patient made you suspicious that they have a problem, a more significant problem than my back hurts, right? So 4 cues for each patient. So this is the kind of, you have to go, wait, what's a cue? What is a cue? A clue. Yes, we're investigators, little nurse investigators, that's right. NCIS nursing, right? And so we're going to identify, try and figure out what's going on with these patients and fix it. So what clues? So either in their history, their case, or the things that the UAP told you about. So for Mr. Hudson, can you give me 4 things that are making you go, all may not be good? Itching. Low back pain. No, he has itching and low back pain. He's wanting some for pain. Remember, you can go back to his case and think about something in his case that might make you think, I probably should be looking for something. His hemoglobin is really low.
His pulse is just a little bit elevated.
A little bit tachycardic? Okay. All right, so what about Jo Bennett? What about her, or Howard? Howard's next on the list. What about him was making you think, I'm worried about him?
Neuro symptoms.
Howard, he's got neurosis symptom, he's weak. What's his other neuro symptom?
Or I thought we were.
No, we're on Howard.
Howard.
Not chills.
He's got chills. He threw up. I heard somebody say vomiting. He threw up twice. And what about his history makes you worry about chills and emesis? He's in the nadir after his chemo. What was that nadir? What's that word mean? The nadir of your chemotherapy. It's the chemo action is kind of peaking. It means that it's the point in your therapy when your blood count's the lowest. Remember, in chemo, the chemo drugs are bone marrow destroying, right? And so they make your white cells, platelets, red cells go down. Does this patient have low white cells, red cells, and platelets? He does. So what is he at risk for because of that? Infection, certainly, but he just got a unit of blood. Okay. And then there's Miss Bennett. Miss Bennett. And Miss Bennett now isn't oriented. She's having difficulty breathing. She wants to sit up more. She's got a broken hand. What about her makes you think she's high risk for something? Something's going on. I need to check her. Say it again.
An allergic reaction?
Maybe. What about it makes you, I mean, it's not my decision. You're the RN. Mitral valve prolapse. A prolapse mitral valve means that, it's not closing right. She could have clots because anytime you've got a valve disorder, that's a possibility. But it's also, they also have leaky valves, so they're repumping blood twice in some cases. And she's having, so, I don't know. What else do you think? So what about her?
No, she just had surgery.
She just had surgery. She came out of surgery just a little bit ago. And she's having trouble breathing. And her PT was 1.8. So, isn't that what it says?
INR is 1.8.
INR 1.8, PT is 18. So tell me about that PT INR. What is that relationship about?
She's not climbing. She's prolonged climbing.
Prothrombin time, prolonged. The INR, it means, what drug do you think she's probably on if we're going for that PT INR ratio? What drug? Warfarin, right? She's come out of surgery after a hip replacement. She's probably on warfarin, right? And we've got a clotting time that is almost double, so we're getting towards therapeutic, right? But it also means if your clotting time is slower, it means you're likely to bleed, right? And in her history, she broke her hip. She fell, traumatic injury, right? A hip capsule can hold 1 liter or 2 of blood without having obvious symptoms, nothing like where you're losing blood on the floor. We don't see it, it's internal. She's third spaced it. And so we know she has a low hemoglobin, and she has a traumatic injury, and we know she's not got good, we know her bleeding is prolonged, right? And so now she had a unit of blood, we were trying to fix it, right? We're doing all the good things we're supposed to try and do to fix it, okay? But now she can't breathe, and she needs to sit up to breathe, and she's got a few symptoms, right? And the last one, Oscar Martinez, he's the guy who had multiple blood transfusions, and now, this poor gentleman, he says he's weak and he's chilled, his muscles are spasming. He's having contractions of muscles that are uncomfortable and painful, right? So now, the next thing I'm asking you to do is take each of these patients is having a blood transfusion reaction, a complication of blood transfusions. And that's something you discussed, right? You have a PowerPoint, you can look at it, use it. I want you to take a minute and review each of the cases and decide which transfusion reaction you think each of those patients is having. So next to the transfusion reaction, write the name of the patient that you think is having it and why you chose that for that patient. You might have to pull up your PowerPoint if you can't remember them all, because I know you've had other things going on today.